Hello, everyone. I'd like to welcome you to today's webinar focusing on HIPAA compliance as it relates to protecting EPHI, electronic protected health information residing on equipment taken out of service. I'm Steve Chafitz, president of EN, and we are a data security company specializing in the secure destruction of electronic media and the recycling of end-of-life electronic equipment. Today, I'll be focusing on a specialized area of cybersecurity, which relates to maintaining compliance with the securing and destroying of personal identifiable information with a focus on required HIPAA physical safeguards. It's important to note that although we are focused on HIPAA requirements, every entity, no matter what type of business, you all have similar responsibilities to safeguard personal identifiable information, and obviously your company's confidential information. I'll be covering a lot of areas of importance. My goal is to make each of you aware of the specific areas you need to focus on to safeguard data and comply with the federal regulations. You can use the chat icon on the left of your screen to write down your questions, and I'll wait to the end to answer your questions. If there are additional questions that you may have after the webinar, there'll be contact information. You can reach us and we'll answer the questions as best as we can. I'm sure you'll gain a lot of good information this afternoon, so let's get started. You can see one of the things we really want you to be able to do today is avoid major fines and in some cases prison time if you're not in compliance with the HIPAA's final security rule. Some of the topics that we'll be discussing today: how does the HIPAA disposal regulation impact your organization? What is necessary for staying compliant with the HIPAA final security rule? How can you develop written policies and procedures for safeguarding data? And that's going to be one of the most important things we're going to be speaking about. Which methods work for sanitizing data and which do not? And why your IT department shouldn't and can't be the solution to protecting data on end-of-life equipment. What to look for when vetting a data destruction vendor, and what the requirements for notification in the event of a data breach. And hopefully after today, we'll tell you how you can eliminate data breaches. And it's not just HIPAA that you need to comply with. There's a variety of federal regulations related to safeguarding a wide range of data. And you're probably familiar with these acronyms: SOX, GLB, FACTA, FISMA, COPA, and others. These are all regulations. No matter the type of business you have, you probably fall into one or more of these categories. But like I said, today we'll be focusing on electronic protected health information, referred to as EPHI. We'll also be using PII today, which is personal identifiable information. So who does HIPAA apply to? It applies to covered entities. And under HIPAA, covered entities are defined and include health plans, including employee-sponsored health plans, healthcare information clearinghouses, healthcare providers that conduct certain electronic transactions, and basically any person or organization who furnishes bills or is paid for healthcare in the normal course of business. And the HIPAA privacy rule really is going to regulate how you have to protect your data. And the goal of the HIPAA privacy rule is to maintain the confidentiality of protected health information. And that's the key here. You are obligated to maintain the confidentiality of protected health information. And if you don't, we'll discuss this later, there could be, and there are, very serious fines and very, very tough consequences if you don't maintain the confidentiality of that information. And HIPAA defines personal health information as individually identifiable health information that is created, received, stored, or transmitted by a covered entity. So it's basically anything that can identify an individual that you've created, received, or stored, or transmitted. And examples of electronic protected health information would be any type of information that relates to and identifies a patient. That's quite obvious. Billing information for a patient, email to doctor's office appointment notes. And here's something we're really going to focus on later, is data that's stored on various types of equipment that contain MRI, CAT scan, X-ray, and other digital data as a result of a lot of medical tests. Obviously, blood tests, laboratory results, and phone records. And as a covered entity, you have to comply with very specific regulations related to protecting EPHI. And these regulations fall under the HIPAA's final security rule. For those of you that are involved with HIPAA, there's numerous federal regulations that cross the entire spectrum of medical records and safekeeping of records and how you handle patient information. We're going to just be working on today HIPAA's final security rule. And the final security rule spells out what covered entities must do to safeguard personal health information. And more specifically, the goals are to ensure the availability, confidentiality, and integrity of electronic PHI, to protect against any reasonable anticipated threats to the security of the protected health information, to guard against reasonable anticipated impermissible use of or disclosed of electronic PHI. And I'll talk about a case later where someone actually went to jail for looking at electronic protected health information that he didn't have the right to see. And also to verify the compliance of the health plan workforce members. And the security rule provides more detailed requirements for securing PHI that is used, stored, and transmitted electronically. And we're going to be talking about electronic protected information that's used and stored primarily. And covered entities really need to develop a security compliance plan that details the steps taken to address each of the safeguards. And this is what's going to be required under the final security rule for the physical safeguards, which we'll be talking about shortly. So how does HIPAA disposal rule affect a covered organization? If you're a covered organization under HIPAA, you must adhere to every specific guideline when it comes to dealing with data residing on equipment and devices taken out of service. And as you're well aware, it's more than just a hard drive today on a PC or laptop that contains data. A variety of medical equipment and devices and other office equipment retain data forever, and a lot of that data is personal health information, which you're going to have to learn how to take care of as we move forward. The security standards of physical safeguards, you have to comply with the following regulation, and it's under the disposal rule. And the disposal implementation specification is very clear. It states that covered entities must, and this is the crux of the entire rule. It's on these 4 lines, and if you don't abide by them, the fines are in the millions of dollars. You must implement policies and procedures to address the final disposition of electronic protected health information and or the hardware or electronic media in which it is stored. And what that means is when they talk about final disposition, when equipment is taken out of service, the data that resides on that equipment, you have to maintain the security, keep it protected, and you're going to have to come up with policies and procedures of how to get rid of that data, how it needs to be destroyed, which we'll talk about later. So what it really means in plain terms, a covered entity, as covered entities replace and update hardware and medical equipment that contains data, you must have policies and procedures in place per this rule to prevent EPHI from being disclosed while disposing of EPHI or electronic media and devices used to store it. This is something a lot of people don't think about, but when you take a piece of equipment out of service and it has a hard drive or other media on it, and you want to reuse the equipment, you cannot send it to another location and have the electronic protected information still available, because it may go to someone that doesn't have the authority to view and access that information. So you have to implement procedures for removal of electronic protected health information from that electronic media before the media is made available for reuse. And you have to develop and implement procedures for removing the EPHI from electronic media before reuse. And if you're going to reuse it, the only way you can reuse the data, or actually eliminate the data on electronic media, is through software-based solutions. You can't degauss it, you can't drill holes in it like some people do, which isn't really a proper method, but you have to use software-based solutions that guarantee all the data has been taken off. And the way to do that is a contract with a third party to ensure any IT equipment you are donating or selling has been completely purged of data. So if you want to donate something, it's very, very important. You may have a doctor or a medical professional that came to view you from another area, and you may want to donate something to them. It's extremely important to make certain the data is removed before you donate the equipment. The other thing is accountability. You have to maintain a record of the movements of the hardware and electronic media and any person responsible therefore. So if you're going to give hardware to somebody or donate hardware, you have to know where it went, who has it, and you have to demonstrate that the data has been removed from the device. I'm just going to take a break here for a moment. If you have any questions, now's a good time to send some in. Was there no audio? They couldn't hear me. Could not hear me. Yeah, I see it there. And as we move on, one of the things you need to do is identify all types of hardware and electronic media that must be tracked. This would include hard drives, solid-state devices, magnetic tape, optical discs, or digital memory cards in the equipment and devices they reside on. And one of the things you have to really be concerned about today is SSDs, or solid-state devices. Removing data off of SSDs isn't done in the traditional way that you would remove data off of hard drives. So let's talk about how we can be compliant. You have to develop and implement policies and procedures that address disposal of the EPHI and or the hardware electronic media in which it was stored. And that is the crux of the security rule that we showed earlier, and it's absolutely essential that you develop the policies and procedures if you want to be compliant with HIPAA's final security rule. And also you have to make certain that the hardware electronic media is unusable and inaccessible. Once again, you have to create policies and procedures that specify the use of a technology, such as software, if you're going to reuse it, or specialized pieces of equipment, such as a degausser, if you're not going to reuse it, that make the health information and the hardware or electronic media unusable and inaccessible, and it can't be read by anybody whatsoever. One of the ways you can accomplish the above is by contract with a third party to ensure you have a defendable audit trail to show you have properly destroyed the data and properly recycled the media. You will need certification that you can demonstrate that the data has been completely removed and is totally unrecoverable. So how can you destroy personal health information? Well, when a covered entity disposes of electronic media such as hard drives, solid-state devices, floppy disks, optical disks, magnetic tapes, audio tapes, or any other magnetic media that contains health information, they are required to make the media unusable or inaccessible by any means whatsoever. So when you remove the data, if it went to a forensic laboratory, you have to demonstrate that data cannot be recovered. And normal data deletion techniques are not adequate to meet this requirement. And it's not just PCs that contain data. Many medical devices have telemetry requirements, which require patient data to be both present within the device, resident memory, and to be transmitted to other monitoring stations where they retain the data. And as you know, laptops and tablets, cell phones, PDAs, USBs, phone service, copiers, printers, and faxes all contain data, plus a wide variety of other electronic devices. So it's a huge amount of electronic devices and equipment that retain data that you have to be extremely concerned about to make certain before they move on anywhere that the data is destroyed. This is a good example of a machine that retained data. Copy machines are computers and should be managed and maintained by your IT department. They have hard drives in them that retain a significant amount of data. And as you can see on the right of this slide, the Health and Human Services sent out with Affinity Health Plan for $1,216,000 for data that was received off of a lease copier. The copy was returned without the data being purged, and 300,000 individuals may have been affected. The copy was sold, and the data was found on the copiers. What we suggest you do when you're leasing equipment, you should have in the lease agreement, when you're returning the equipment, you will return it without the hard drive or any other data retaining media. You don't want to return any media along with the device and rely on the other person to destroy the data. In this case, as you can see, Infinity may have thought the leasing company was going to destroy the data, and they didn't, and it cost them over $1 million. So what do you do to safeguard the data? Well, the first thing you need to know is how to sanitize data beyond forensic reconstruction if the media is taken out of service. You need to encrypt data in order to restrict access. You need to encrypt laptops, USB devices, and other portable media. If you haven't read, I'll show some references later. When laptops have been stolen or USB devices have been lost and found by other people, when they were not encrypted, there was a tremendous loss of data and serious fines resulted. So how do you start? Well, I keep mentioning this and I can't emphasize it enough. Unless you create the written policies and procedures, you're not going to be able to know what you have to do, when you have to do it to protect the data. Then you need to designate someone to be responsible for inspecting all of the equipment for data. Don't assume if someone said there's no data in it, you need someone that you can designate that has a responsibility to look into the equipment to be certain there's no data retained on the device before you dispose of it or send it to another location. And to remove data containing media, it has to be properly sanitized. And there's two methods, or two standards actually. Actually, they're referred to as guidelines. The National Institute of Standards and Technology has a document which is referred to 800-88, which is easily available on the internet. And the National Security has guidelines. Now, just because it says NSA, that doesn't mean they're designed to protect against spies. They have the same guidelines similar to NIST. And if you follow those, you can be assured that the data cannot be recovered. You just can't assume by doing certain things and someone says the data's gone, it's gone. It's not going to be gone. And if you have someone destroy the data for you, you need a spot check and confirm the data is purged beyond forensic reconstruction. That means if it went to a forensic laboratory, you could not get the data back. And medical records are worth a significant amount of money to identity thefts, which we'll talk about later. So it's very important. You cannot reconstruct the data. You need to assign responsibility. Every PC, laptop, cell phone, PDA, medical equipment, which contains data must be inspected, and each device must be labeled indicating no data is present, and the name of the person inspecting it must be noted. If you have a hard drive, a solid-state device, or any type of electronic memory device, and you have one on the table with data and one next to it without data, there's absolutely no way to tell which has data and which doesn't. So what you need to do, since they look exactly alike, you need to have a way to identify that the data has been removed. And you can see on this hard drive, it has a tag that says data's wiped. It was wiped on 10/15/13 by BJ, which is the person's initials. And in this case, many drives were wiped on multiple stations, and this was station number 2. And as part of this process is a quality control check. And if they find drives, if this drive failed, then they'd go back to every drive that was wiped on station 2 and recheck them. So you have to identify the drives or the media the data has been removed from. Otherwise, you put it in a drawer, you take it out of the drawer, you put it back in the drawer, you'll never know if it has data on it or it doesn't. So how do you know which data device which contains data? You just don't know. You look at a copy machine and people don't know there's data on it. Or you look at a phone system and you don't know there's data on it. So what you really need to do is you need to place identifiable labeling on the equipment and devices which retain data. So there's no question when someone looks at it while they're using it or when they've taken out a service, it still contains data. And one of the things that we've developed are labels. In this case, you can see what it says. It's a data security warning. It says this device that contains data. And you have to follow specific guidelines to purge the data. And when this is on a piece of equipment, and this is another indicia that you could put on to show this contains data. It's very visible. There's no question what it means. And this actually came out of a network printer. This is a card that came out of a printer. So if someone's taken this out, they need to know there's a hard drive on there that contains data. And this may seem like it's, going to an extreme, but you can't afford the cost of the penalties for having personal identifiable information compromised. This is simple as putting a label on the back of a phone. It's on a copy machine. People don't realize there's copy machines that have retained data, but they do. And this is a very interesting point that I really want to emphasize, and something that we find from real life experiences. Billions of dollars is spent every day to prevent network intrusions. No matter what facility you have, you're probably being pinged. People are trying to get into your network to get to your hard drive to get the data. But what we're finding is when equipment that was previously heavily protected is taken out of service, it's been replaced, there's been a refresh, the equipment has been removed for some reason. Many times, and we have seen this, and I have not been into your facilities, but I assure you there's a room set aside where there's old equipment just sitting in the corner. It could be old phone systems, it could be copiers, it could be laptops, it could be just about anything. In other cases, for large institutions, they'll actually move a large amount of equipment into a warehouse or a large storage area, maybe in a maintenance area, where once again, it's totally unsecured. And this is where data breaches happen, and the most easy data breach to prevent. So it's essential that when you take equipment out of service and you spent so much money to protect it when it was in the server room, you can't just send it out as an orphan somewhere to be sitting, because if one computer on this large stack was disappeared, no one's really going to miss it. And it could be the particular unit that was loaded with a terabyte full of data that would really, really get your company or your healthcare providing service in a lot of trouble. So, as I mentioned, a major data breach is likely. So how do we protect from a data breach. And we're back to the same thing. I'm going over and over. It's practice, 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 policies and procedures, policies and procedures. And the equipment must be processed immediately when you take it out of service. If you're taking a piece of equipment out of service, don't stick it in a closet and hope somebody will get to it. You put it in a triage area. You assign somebody that's going to go through it. You have to store it in a secure location. And then you have to establish a fail-safe method of identifying all the equipment that retains data. And don't assume some equipment is not going to retain data. The new phone systems today retain data. As we talked about, copy machines, printers retain data. Almost all medical devices retain data. And someone needs to be designated as the person to be responsible for inspecting all end-of-life equipment for the presence of data. So some of the consequences of non-compliance can be pretty bad. And it could result in costly data breaches and significant fines. According to the latest Poneman study for 2014, the average cost of a data breach to a company was $3.5 million. It was up 15% from the previous year. And the average cost per record was $201. So if you lose 10,000 records, multiply that by $201, that's the financial loss. But that doesn't include the cost to your reputation, your brand, and goodwill. It's more than just the dollars. It's all the other implications that revolve around that data leak, that data breach. This is very important. People are pretty much thinking that the threat is from the outside. Hacking or outside threats for healthcare data breaches accounted for only 23% of the breaches. And loss or theft of device with information on them accounts for 68% of all the breaches. So only 23% came in what I call the front door, and 68% were out the back door. Something you have to absolutely be concerned about. And why do you have to be concerned about it if you're a healthcare provider? Because they're identity thieves that market personal identifiable information. And health records are a major target for medical records. You can go on the internet and you can buy a credit card number for $1. And from what I understand, they guarantee it. If it doesn't work, they'll give you your money back. But healthcare records go for $50 per record, because healthcare records provide a tremendous opportunity for identity thieves, especially today with the cost of insurance. People have been stealing health identities and going in and actually getting medical care provided under someone else's identification. You probably haven't heard about much enforcement in the last several years for HIPAA violations. The Office of Civil Rights was the agency that enforced HIPAA, and there was not a lot of enforcement. But now under the HITECH Act, the Attorney General from each state can enforce the HIPAA data security provision. And what that means is, if a constituent or resident of their state has been subject to a data breach, or their information has become available to identity thieves, the state attorney can file an action against a healthcare provider for a small amount or many millions of dollars. And you'll see in a few moments that they've done that. And the state gets to retain the money. So there's a significant advantage for the state attorney generals to go after HIPAA violations when it comes to the disclosure of personal identifiable information. There's been suits in many states. The attorney general has prevailed, and there have been settlements for significant amounts of money. If you notice where I have underlined, covered entities and specific individuals who knowingly obtain or disclose individual identifiable health information in violation of the administration simplification rule can face a fine up to $50,000 as well as imprisonment up to 1 year. And at the bottom, if your intent is to sell, transfer, and other things for commercial advantage, you're looking at a $250,000 fine and 10 years in prison. And if I'm going to give you a reference to look at, many of these fines have already been implemented, and there are companies and individuals that have suffered not only individually, but the healthcare or the entity has had to pay large amounts of money. The civil penalties are not imposed if the violation is corrected within 30 days. But this is where it's been raised. If you look down, if it's willful neglect, which means you knew about it and you didn't do anything about it, I'm sorry, if you knew about it and corrected it, it's $10,000 per violation, $250,000 for repeated, and for the maximum penalties up to $1.5 million. But if it's willful neglect and it's not corrected, it's $50,000 per violation up to $1.5 million, or $50,000 violation with an annual maximum of $1.5 million. Now, it doesn't sound like these add up to much, but you can see on this page here, Blue Cross Blue Shield was fined $1,500,000. 57 unencrypted hard drives were stored in a storage cabinet, actually a storage room, and they were stolen, and they paid that amount. Here's Affinity for the return copy machines without erasing the hard drives, and here's a breached unsecured laptop was stolen. If you write down this reference, it'll show a significant amount of fines for high dollars. And the source is, if you go to HHS, case examples, and resolution agreements, if you just Google that, then scroll down, you will see all the current fines and what they were for. And most of them were for the disclosure or the lack of safeguarding of electronic protected health information. So what do you need to do to start safeguarding data? The first thing you need to do is know how to sanitize data beyond forensic reconstruction. Deleting, formatting, drilling holes in hard drives, the data is still present. And this may seem obvious, but I've met with IT people that said, well, we've deleted the files, or we reformatted it, or we've drilled holes in it. In every one of those cases, including drilling holes, the data can be recovered. Now, drilling holes makes it most difficult, but deleting and reformatting, that's the easiest. You can go online and get free software and you can recover the data. So you have to follow the recommended guidelines to do that. And they're very specific to destroy data beyond forensic reconstruction. We talked about this before. NIST 888 is a guideline, and NSA has a guideline. If you Google NIST 888, it'll say guidelines for the destruction of electronic media and other media. And you can scroll down. It tells you how to destroy or to get data removed from all types of media. It's an excellent reference. Well, one of the things is, can you leave it to your IT department to sanitize the data? Well, you really can't, because you can't assume that the IT department is finding all the media. Let's assume they were required to find the media in the copy machine. They didn't do that. Don't assume they're sanitizing all the data. And we, or myself, can cite this as real-world examples. We've received hard drives from IT departments with the assurance there's absolutely no data left on them, and they were full of data. In some cases, the drives are reformatted or deleted. And when you put them into a computer, it'll say there's no data, but if you use recovery software, they're definitely there. And also, it's not their mission. The IT department, and they're great, especially at healthcare providers, because they have a tremendous responsibility. Their mission is to keep the network up and operating, put patches in, make certain the help desk is manned, be there at 3 o'clock in the morning if a system's down, and have the latest software and antivirus software. The mission really isn't to spend time to destroy data on hard drives. If you were going to wipe data on hard drives with a software program, it could take 2 hours or more. If you had 100 hard drives, that's 200 man hours. That is just not where they should be spending their time. And the most important thing, the IT department cannot certify their own work. They cannot self-certify. That's why a hospital can't certify their ability to perform hospital services. An outside certifying body has to come in. And the same thing to certify the destruction of data. They have to have a third party who is certified to guarantee the data has been destroyed and provide written certification that the data cannot be recovered by any means whatsoever. This is a good example of why IT departments shouldn't be doing it. Government agencies and major corporations have excellent IT departments. I mean, the best in the world. But they use data sanitation experts to provide independent certification. They realize their time is not well spent by trying to do it. They also realize they can't self-certify. And not only is it done more efficiently and more affordably, they have a defendable audit trail that certifies they've done it properly. And that's very, very important. You get an independent, verifiable, and defendable certification that the data has been destroyed, and it's done in a far more cost-effective way. This is something that we've seen, and I'm certain if anyone's been into the IT areas, they've seen the same thing. When you go into an IT room, under the desk or on the desk, they'll have loads of hard drives waiting for someone to purge the data. And if you had to purge the data, and this particular amount of hard drives could literally take months. But while they're there, they're totally unsecure in violation of HIPAA, unless the room had a limited access security codes. It's just not the best thing to do, and that's one of the reasons why you need to have someone do it quickly and efficiently. When you get certification that the data was destroyed and it's not recoverable, that's what you need to show that you've conformed to HIPAA's final security rule. And a qualified and certified secure data sanitization vendor can quickly sanitize the media and provide a certificate of data sanitization. Here's an example of one. Certificate of data sanitization. The medical healthcare provider has been redacted. It says 64 hard drives and 6 DLT tapes on the date, and the destruction technician who did it signed their name, and a company officer signed their name. And there's the serial numbers of 64 unique hard drives and a quantity of 6 DLT tapes. So if that entity gets audited and they want to show or required to show what they did with the hard drives in that last refresh of 69 computers, here's the information. And although we did this, if you notice on the bottom, the company is NAID AAA certified, which means they have earned the certification and have been vetted to guarantee the data cannot be recovered by any means whatsoever. So that's the certification that's required to provide to an auditing body to demonstrate the data is gone, cannot come back, and the entity has met their security rule requirements. Another thing too, when you saw under the desk where all the media was laying there, you really should secure the media. Vendors should be able to provide you a secure bin to put media in. In this case, there's a slot on the top. You can put in hard drives, DVDs, magnetic media, laptops, cell phones, anything. When we put them out, there's a lock on it. The client does not have the key, and then we bring it back and it's secured and we do what's required. But this is far better than having the hard drives sitting on the floor under bench to be taken by somebody who may think they need a hard drive. So what can you do? You need to properly identify the equipment taken out of service. And here's 2 different labels. If you look at that room that we had before, nobody's going to know if the equipment's going to go back in service, whether they're going to get it recycled, or whether there's data on it. There's no data on it. Well, this green label on top says it's a decommissioned item. It's no longer in service, hold for recycling. And the bottom one says decommissioned item, no longer in service, and hold for secure data center destruction. Well, it's obvious that if you see these yellow and pink tabs on equipment, you know exactly what has to be done to it. And every time you look at it, you don't have to keep touching it and going inside to figure out what's going on. Here's another issue that you really have to address. Unfortunately, if an IT department is not going to destroy the data themselves and they look for an outside vendor, it may go to somebody in procurement who's totally unfamiliar with data security, and they're going to look for data security as a commodity. And they're going to look for the lowest price. They're not going to look for the credentials. They're not going to look for the ability of the company to provide it, the certification and references. They just want to get it done for the lowest price. So don't risk saving a data breach. Don't risk a data breach by just saving $50. When you have it done properly, you're actually buying insurance to prevent a data breach. You're not buying a new PC. And I give the example, you can spend $50 and get it done right, or be on the front page of the New York Times or the Washington Post. It's a small investment to make certain it's done properly. And you need best value pricing. You need to make certain that what you're getting for the price is giving you all the assurances you need to make certain it's done properly and you are protected in an audit. Well, this is something that you may have been exposed to. We certainly have been exposed to. Someone says, I got the best price from 800 Got Junk. In this case, actually, it was 800 Got a Truck. 800 Got Junk, by the way, is one of our clients. And when they take equipment in, we actually destroy the data for them so they can guarantee their clients the equipment has been destroyed, the data has been destroyed properly, and the equipment has been recycled. But this is 800 Got a Truck. They do it differently. And you can say, well, I'm not worried. He'll say he'll indemnify me. Well, the indemnification actually means nothing. You are responsible to secure and protect the data from cradle to grave. You're the one that created the data. You're the one that's responsible for the data. Any indemnification they give you is basically going to be worthless. They say they'll do it for free. Well, if there's no consideration, there's no obligation. If they do it for free and it doesn't turn out they did a good job, you really can't go back to them. They're going to say, well, I didn't charge anything. What did you expect? In order to get this done properly, you have to pay for the service. The equipment to perform these services, to make certain the data cannot be recovered, is very expensive. The people have to be trained properly. They have to go through their own audit in the company. So there's a fee for them just to provide you the service. So they can't give it to you for free, and you can't expect it to be done right. And when they do it, you have to make certain they're competent. Are they certified? Do they have the proper certifications? And do they have the proper equipment? To degauss a hard drive, if you're no longer going to use it, the degausser has to be on the NSA Evaluated List. And the lowest price of a degausser on the NSA Evaluated List is tens of thousands of dollars because it has to meet very specific requirements. I'm going to get back to indemnifying. They'll say they'll indemnify you. Whoever you have to perform your data sanitization and whatever their qualifications, you are the responsible party to safeguard the data. You're the person, as I said, you created the data, you maintain the data, you have to safeguard the data. And if the person that you give it to has a data breach, no one's going to go after that person. They're going to go after you. Chances are that person is not going to have enough money to meet the fines, but you are the person that was responsible. It's essential that you vet your vendors. And one of the things that's new on the market, you really need to consider is getting data breach insurance protection. The cost of a data breach can be significant, and if you have the written policies and procedures in place, if you do all the things that we talked about here in this webinar, you'll be able to get a good rate for the data breach insurance, which will protect you if something unfortunate happens and information gets compromised. So let's talk about using a third party. When you select a vendor to destroy your data, you have to make certain, are they certified to perform the task? There is very specific certification that you need to have the vendor comply with if they're going to destroy data. And the primary certification is the National Association of Information Destruction, which is NAID, and they provide a AAA certification to companies that demonstrated they met their requirements for destroying data and the data cannot be recovered by any means. And to get the certification, they need to be audited. They receive media with data. They destroy the data. The certifying body sends the data containing media to a forensic laboratory to make certain the data is not there and no longer recoverable. And also, do they provide a certificate of data destruction? 1-800-GOT-A-TRUCK can give you a certificate of data destruction, but what do they have to fall back on? What gives them the right to certify it? That piece of paper doesn't mean anything unless they have the proper certifications to provide you the certificate of destruction. And do their employees undergo background checks? They just have anyone doing the work? Are they security people trained in this? Another thing that's going to happen when you start removing data from end-of-life equipment, you're going to have to properly recycle the equipment. Entities want to demonstrate good environmental stewardship, but also you can't put it in a landfill. So part of this is selecting an electronic recycler. And one of the things you need to ask them, do they hold the current industry recognized certifications? Until recently, there were no certifying bodies that controlled companies that recycle electronics. Right now, there's eStewards and R2 and R2 Rios. But something, if you're dealing with a vendor now that has R2 certification, that certification expires December 31st of this year. They need to, actually it'll expire December 31st, 2014. For them to be current and have a valid certification, they need to have the new certification, which is R2 2013, plus they will need ISO 14001 and OHAS 18001. So you need a lot of qualifications to do this properly. So you just don't want to have the person that's going to provide the lowest price without the ability to certify it. Do they have a zero landfill policy? Do they guarantee 100% of material is recycled? And more importantly, do they guarantee no illegal exporting of material? So I'm going to touch upon a whole different area here now. We're almost done. We learned about what you need to do. You have to have policies and procedures. You have to identify the equipment that retains the data. And you have to seek an outside person to help you. And the outside person that's going to help you is going to be referred to as a business associate. And a business associate is a person or entity that performs certain functions or activities that involve the use or disclosure of protected health information on behalf of or provide service to the covered entity. Your vendor who performs data sanitization destruction is a business associate. Now, in the case of our business, it's just a technicality because we receive the data, but we don't look at it, we don't manipulate it, we don't store it, it's instantly destroyed. However, we do generate business associate agreements with healthcare providers to make certain there's no question that the association between the covered entity and the business associate is in writing. So what is a business associate agreement? It's a contract between the HIPAA covered entity and the business associate that is used to protect the PHI in accordance with the HIPAA guidelines. This is the good part, which I hope you never have to do. If there's a breach, there are very specific breach notification requirements. Following a breach of unsecured protected health information, you have to notify the Secretary of Health and Human Services, and in certain circumstances, you have to notify the media, and business associates must notify covered entities. Notifying the media can be pretty disastrous. The first thing you have to do is provide individual notice. Whatever the amount of files were disclosed, you have to notify each of the affected individually of the breach of undisclosed, unsecured, protected health information. If there's a breach affecting more than 500 residents of a state jurisdiction, and that's very little, you can get tens of thousands on a thumb drive, you have to publish that in a prominent media outlet serving the state. You have to send a notice to the Secretary of Health and Human Services. And once again, not only are you notifying people, but you're telling people that they had data that you controlled improperly, and now the world knows that you've created a problem for them. So that's the end of our webinar. There's some contact information. If you have any questions, you can send them in. I did get some questions earlier that I can go over with you and answer. One of the questions I received is, why can't my IT department certify that they wiped our hard drives? Well, they can't certify that they wiped your hard drives because, as I mentioned, they don't have the ability to self-certify, number one. Number two, it's probably going to be more costly to have them do it beside you doing it yourself. And third, they don't have the time to do that. And once again, many times they'll say something's been destroyed because someone in the IT department said the data was destroyed and it wasn't. So you really can't rely on them, and you're putting an undue burden on them. Another question received is relating to solid state devices, SSDs. Most media on computers are on hard drives, which is magnetic media. Magnetic media can be destroyed in various ways. One of the ways is to degauss the hard drive, which is subjecting the drive to a very powerful magnet, which will remove all the data, and that also destroys the hard drive, and it cannot be used any longer. An SSD is a solid state device that has electronic memory, and it cannot be destroyed by magnetic forces. It is difficult to destroy data on certain SSDs. So if you have an SSD and you want to destroy the data yourself, my suggestion is you go to the manufacturer's site and look for recommended ways to do that. On SSDs and hardware, there is what's referred to as firmware that's embedded in hard drives and some of the SSDs that you cannot initiate without a special application being performed. And when that's firmware is initiated, it sets up a sequence which will destroy all the data on the media. But that's something that's not easily done without specific software. Another question was, how do we know which devices retain data? Well, if you're not sure and you're buying something, well, one thing, you can assume all new multi-purpose copy machines and network printers retain data. Almost all medical equipment retains data. CAT scan machines, MRIs, X-ray machines, they all retain data by the nature of their imaging today. But if you're getting a device and you're not certain, look at the technical specifications on the device to see what the manufacturer says with relation to it retaining data, or contact the manufacturer. Well, that's all the questions that I have. I hope you enjoyed and learned a lot from today's presentation. And if you have any questions, feel free to contact us. We'd be happy to help you in any way we can. And remember, do what you can so you stay off the front page of the local newspapers by preventing any type of data breach.